Hi, my name is Sabria Bennett and I'm a student nurse at the University of South Alabama. Today I'll be performing a respiratory assessment. First, I would like to note that I have performed hand hygiene. Okay, another thing that I would like to note is that in an adult, it is standard for the respiratory breaths to be between 10 to 12 breaths per minute or between 12 to 20 breaths per minute. Next, I would like to note that the respiratory pattern in the assessment, I am looking for regular, irregular, or any accessory muscles use. Next, what I would like to note within this assessment is that I'm looking for the depth. Moderate means that it is standard. Next, I am looking for how deep it is, which means how much activity is going to be in the chest, how much movement. And next, I'm going to be looking for how shallow it is, which is very little rise or fall. And what I meant to say for deep, it is a lot of activity. So next, what I'm going to do is assess the transverse A and P. Okay. I would first like to note that it is 2 to 1 and there is no signs of barrel chest. Next, what I would like to assess is for any lesions anteriorly and posteriorly. Okay. Okay. Anteriorly or posteriorly, there are no lesions. Okay, and now I'm going to assess for any scarring. Okay. Okay. Anteriorly or posteriorly, there is also no scarring. Now I'm going to assess for the hairs on her body. Okay. After looking anteriorly and posteriorly, I noted that there is fine billow, which is also most common in females. Now what I'm going to observe is her skin. Okay, I'm going to first look at her ankles. Okay, now can I see your wrists, your hands, and then your face, okay? So what I'm noting is between her face and her thoracic area, and the rest of the parts of the body that I have assessed, they are consistent in one color to go with her face, okay? So the next thing that I'm going to assess is her nails. Can I see your hand? Okay, I'm noting that the nails are, I'm sorry, I did make one mistake. It's not nails. I would then assess her lips and the mucous membrane. Okay. I'm gonna note that her lips are pink. They have no sign of cyanosis, and they are also moist. Can I see the inside of your mouth? I'm looking at her buccal mucosa. It's pink, moist, and also no signs of cyanosis. Now I will look at her nails. Looking at her nails, they are pink, slightly convex, and no signs of cyanosis. Her capillary fill is less than 3 seconds. And now I will be looking at, could you put your hand in the shape of a diamond for me? In this shape right here, I am noting that there is no clubbing because the degree at which her nails are at is not greater than 160 degrees. Okay, so next what I will be doing is palpating the thorax. Anteriorly and posteriorly, I see that there is no crepitation. Now what I'm going to do is I'm going to measure for any chest expansion anteriorly and posteriorly. If you can take deep breaths in and out for me. Okay, now I'm going to go to the back. This way.
You gotta make sure they can see it.
I'm going to measure chest expansion posteriorly now. Deep breath in and out. Okay, so now what I'm noting is that posteriorly and anteriorly her chest expansions were symmetrical. So now what I'm going to do is I'm going to auscultate the respiration sounds by using my stethoscope. I will need you to breathe through your mouth, and I will need you to take deep breaths, and this may go pretty fast. Okay, I have done that anteriorly. Now we'll perform the same thing and do it posteriorly. Okay, now that I have done that, excuse me, in my assessment, I have measured for the vesicular, which is located in the peripheral lung field. So I have measured for that anterior and posteriorly. And I would like to note that it was low pitch and soft. It was also, the inspiration was greater than the expiration. And like I said, it was anteriorly and posteriorly. For the bronchovesicular, I would like to note that I did that both anteriorly and posteriorly. That is located over the major bronchi. The sounds are moderate, and it was moderate with also a moderate amplitude, and the inspiration and the expiration were equal. And lastly, the bronchial was measured in the trachea and the larynx, and that was measured anteriorly, and the sound was very high pitched and loud, and the inspiration was less than the expiration. Now, lastly, the significance of this adventitious assessment was to determine whether the patient had possible causes of pneumonia or wheezing, which may be a cause of asthma. And now I would like to conclude my video. Thank you.